Welcome back in, everyone. There is a fairly new service here in Michiana to help people navigate the end of life. It's called Luminary Hospice, which has the end of life doula team. So here to talk about it, we have Jen Edwards here in the green. We've got Tracy here in the middle, and we have Amber as well. Ladies, thank you so much for being here today.
Thank you for having us.
Absolutely. I know this is, not the most fun conversation to approach, but it's an important one because in the end of our lives, we want to be taken care of. We want to be uplifted and supported. That's the ultimate mission, Jen, right, of your program?
Yeah, absolutely. Our mission is really simple with Luminary. It is care that is personal, rooted in community, and grounded in dignity. And that's exactly what we seek to provide every day. We have a saying with our team, be the light. And how can we put light into these everyday situations and care for folks?
Wonderful. So you were telling me, Jen, July is when this program launched for Elkhart and St. Joseph counties as the communities you're serving. Is that right?
Yeah, absolutely. And we're expanding as we're growing, so we're really happy to be providing the services.
Okay. Anyone can answer this. How does this program work? If someone wants to have that doula team be a part of their journey, how do you get started?
I'm Tracy, I'm the end-of-life doula, and so if a patient, especially those people who don't have anyone, no family, then my team, I will follow them from start to finish, with the end of their life. Mm-hmm. So I get to know them, and I get to be their companion and understand who they are, what is their likes. I want to make sure that they live their life before they can't.
Mm-hmm. And maintaining that dignity, right? Because I know that sometimes can be a struggle. People that often, that is a common complaint that are in nursing homes or certain situations, they feel like they lose themselves, right? So how do we avoid that?
What I do is, with end of life, I guide people, patients and families, and I guide them through that whole journey. And that could be with companion, that could be with doing legacy work. I've done memory boxes for people, and I'm present for them if they need education in end of life or even the dying process. I'm there to help with that.
Wonderful. How many families, do you have an estimate ballpark that you've helped here in St. Joe County or Elkhart County so far?
I don't have, it's quite a few. I'm not sure.
Dozens?
Honestly, dozens, yeah.
Okay.
Yes.
That's wonderful. Yeah. And Amber, tell us your role in this journey.
Yeah, so I'm Amber, I'm the hospice care consultant, and so really what my role is to bring light into the community and just tell them that hospice isn't scary. We are here to provide comfort and support and just be that guiding light through every process and everything that a family may be going through, especially during this difficult time. So with our team here, we are just really looking forward to working with the community and just telling them that hospice isn't scary and it's a comfort and support, and that's really what our mission is.
And where exactly are you located?
So we're in the Michiana area, so we serve all around, but if you were to ever want to call us, you can always reach our number. You can Google luminaryhospice.com, or you can give us a call, and you most likely will be talking with me, and I'll help guide you through that process. Yeah.
So this is not an inpatient facility?
So we're everywhere. So wherever a patient calls their home, so that could be in the home, in an assisted or independent living, we
you
will follow
come to them. You bring the care to them.
That's correct.
That's very convenient, and I'm sure that breaks down a lot of roadblocks for people, right?
It does.
It does.
Yeah.
Okay.
Yeah.
What are some of the misconceptions that you guys have heard about the doula process? Because I'm sure a lot of people don't know, right? They're not familiar. This is a newer concept. I know doulas help with pregnancies, right? They help give birth. I'm familiar with that term, but is this a newer concept?
It's really not. It's actually been around, it is and it isn't. It's been around actually from the 1990s until now, and hospices have started using doulas as volunteers in the late 90s. And now, after COVID, they have realized that doulas help with that hospice. We complement the hospice team. Because I'm with the patients actually more often than our core team. And so, and I'm always communicating with the team.
That's fantastic.
Yes.
Do you guys accept Medicare, Medicaid?
We do.
Yep.
Okay.
Yes. So hospice is a Medicare benefit or insurance, but really that's something that we can talk through and walk you through. We always say that there's never a right time for hospice. If you're thinking about hospice, then you should give us a call and we can help you through that.
Wonderful. Ladies, thank you so much for your time. Really appreciate it. The work that you are doing in our community is definitely invaluable. So thank you guys.
Thank you so much for having us.
Absolutely. If you'd like to learn more about this wonderful organization, we'll have a link posted for you on WNDU.com. We've got plenty more to come. Stick with us. We'll be right back.